All set.
All right, I'm Mayor Meg Grenier, and it is 5:30, so we will begin this workshop, village workshop. Anyone outside the village staff who is attending, I would ask to please identify yourselves.
I'm the court reporter. I'm here for Renee. I don't know why you can't see me. I'm sorry, everybody.
All right, that's you, Carrie, right?
Yeah, that's me. Sorry.
You
It
keep
was there.
popping
There we go. Jeez.
keep popping in and out, but
Okay.
all right. Judy, Brandon, you want to go ahead, Brandon?
Brandon Tour with Employee Benefit Center.
Judy Tour with Employee Benefit Center. Hello, everyone.
Hello.
All right, do a quick roll call of village staff. Deputy Mayor Seth Harris. That I just saw him pop on.
Yeah. He's frozen.
Well, Trustee Diane Foley.
Present.
Trustee Brian Marsh.
Present.
Trustee Tim Lane.
Present.
Clerk Don Hanrahan.
Present.
Treasurer Bill Smith.
Present.
On September 2nd.
Harris is here.
I'm sorry?
I'm here. I'm here.
Thanks. On September 2nd, 2021, Governor Kathy Hochul signed legislation extending virtual access to public meetings under New York State's open meeting law, which allows New Yorkers to virtually participate in local government meetings during the COVID-19 pandemic. The legislation was initially implemented by executive order during last year's state of emergency, allows state and local government meetings, hearings and workshops that are normally held in person to be held remotely instead, as long as the public has the ability to view or listen to the meeting, and as long as the meeting is recorded and later transcribed. The statutory change will reduce the need for congregation at public meetings while the Delta variant is prevalent, while ensuring public business can continue. As a workshop for the village board, comments from the public are not going to be accepted. It's a listening thing for the public, and the rest of us will be engaging in that. Judy and Brandon, Carrie is our the one who's going to transcribe and record our minutes, so that's why she is here.
Okay.
So that's the necessary stuff. I guess now we can turn it over to you guys.
Okay. I'll go first.
Everybody else, by Bill speaking, if we could go on mute, because there'll end up being a lot of feedback. Thanks.
All right.
Hang on one
We're
second.
gonna
Yeah, I'm sorry.
Who was that? Oh, Bill Smith. Is that what you want to know, Carrie?
What did you want to know?
Medicare eligible employee or retirees, the CDPHP plan did not go up. It's the same as it was last year and the year before. And our dental plan that we offered people, Delta Dental, that hasn't gone up this year. And the Guardian Vision went down pennies per whatever class of service you want. Single went down like 20 cents or 30 cents, something like that. And a family plan went down 93 cents. So I think those plans are fine. As far as the healthcare plans, I sent you all a couple of spreadsheets. One showing the
Bill, when you're referring to a spreadsheet, will you identify which it is so we can know which one we're looking at here? Okay, thanks.
It's the renewal plan trends, shows quarter one 2019, quarter one 2020, 21 and 22. Across the page, you got the platinum plan, EPO, which is our current plan, gold HMO by CDPHP, Blue Shield, Blue Northeast New York, gold, EPO, Blue Shield Northeast Platinum, and MVP Platinum. And underneath that, it shows, you know, what the cost was for a single, monthly cost for single and it increases or decreases, whatever, for each of those. And then I told you at the bottom, 2019, we had Empire Blue Cross Platinum Blue. 2020, we had the same plan. And 2021, we switched to CDPHP Platinum. So with that, I'll turn it over to Judy and Brandon. Brandon, I guess.
Yeah, thanks, Bill. Brandon Tour with Employee Benefits Center. We sent around that chart that Bill just mentioned. This was just, I guess some folks were wanting to look at the trends over the last few years for each plan we're discussing for 2022. It's helpful info just to see, where they've been going, where they've been moving for the last couple of years. But did anybody have any questions they wanted to ask about this chart? And
Brandon, what are you seeing as the major driver for the cost increases for this batch of renewals? Is it COVID related? I mean, or do you think?
It's all like it's everything. The cost of care. Prescription drugs is a huge driver. Specialty drugs continue to go up and up. And utilization. Folks use their plans. The cost of care. We were hoping that during COVID, there was months when things were locked down. So, but when things opened back up, surgeries went back to, the more, elective surgeries that people were putting off were able to catch up, and the claims were still there for the year. So it wasn't like, even with COVID, even with the lockdowns, the utilization was still high. People are still going. So these plans, every year, each insurance company submits their anticipated utilization, and they anticipate, how much they, how much they brought in premium, how much they've spent out in claims, and they have to, put in requests to the insurance department with the state, how much they can charge for the new year. So these plans, the prices reflect that, that volume of claims experience that they've had.
And if I can add one thing, this is a platinum plan. It doesn't get any better. And if you notice, the co-payments are smaller. This isn't a high deductible plan. And quite frankly, when you have a high deductible plan, people do put things off a little more than if they do not have a deductible. So think about it as more user-friendly for us members when we have a platinum plan with lower co-payments. New York State is community rated, so the rates are the rates, no matter where you shop, based on your region. Your plans will be your plan selected. The rates are the rates. It doesn't matter who you shop with. It doesn't matter if you go direct to a carrier. The prices are the prices.
Yeah, and on that, small group in New York is less than 100 employees. So businesses like the Village, you're lumped in with all the other less than 100 employees in the state, and then it's priced based on zip code of where the business is located.
So that leads me to one of the questions that Bill and I were talking about one day in the office, and they give no incentive for a group to roll over for the next year, or is there ever any ability to look at a longer period of time to guarantee that the Village might enter into a contract for longer than a year at a discounted, at least, with a locked in, agreed upon additional rate for the second year, so that the Village has a little bit more vision as far as what the actual inflated cost will be from period to period?
It's a good question. It's not an option with health insurance. With these community rated plans, they're priced for the year, and there's no discounts. There's no extended, like other lines of coverage. If I get it. If you sign a 3-year commitment, you might get a break. But with health insurance, for these small group plans, there are no discounts or like that.
Yeah, and if I can add to that, Brian, what happens also with these plans when the carriers are putting out their prices for the upcoming years, they also have to contract with all their providers, and every year those prices are negotiable between the different products that the carrier offers and also with different providers. So hospital costs, say St. Peter's, their Trinity Care, that's, Catholic Charities. So they contract with CDPHP or Blue Shield or whatever carrier you're buying from, and they negotiate their claims prices each year. So we don't know. I mean, do Band-Aids cost 9% more this year? Good question. But no, we can't lock in. Again, the rates, the carrier goes and gets the best discounts they can. CDPHP is very rich with the doctors. They are very well liked by the doctors in the community. They offer good services. But again, each one of these carriers negotiates each year their contracted prices for claims. And code number 202 is worth $300, and that's just how it is. So something with the contracting this year, there could be some differences or rate increases are based on that with upcoming claims. They anticipate actuarially what they're going to spend per person. And then the rates are, like Brandon said, with the insurance department, they are approved or not approved. And then the rates come out and the carriers put out their projected rates. This plan you do have is a national plan also. So it does give you the extra coverage throughout the country, which is very much needed at the village. I mean, you have some retirees that are living in other states. So this plan does travel with them, with their families. They have access to networks throughout the country. And that's an expense too. When you offer a national plan, I mean, you're going to, now you have coverage all over the country. Well, the prices here or in South Carolina or North Carolina could be different, higher, lower, based on where the member lives. So again, all that is rolled into these prices. You are offering a platinum plan with national coverage. And the carrier is going to take that into consideration when they're pricing it. Does that make sense?
Yeah.
You have more flexibility. You got more options to leave. I mean, any of you can go to, anyone on the plan can go over to Boston. You can go down to New York City. I mean, you have access. That access costs money. I mean, that's probably a 3 to 5% add-on to a plan to access that. If you want to go straight HMOs, it's, we can take the plans. You can go with a discounted plan because you're not going to pay for the national networks.
Judy, the option 4 has a national plan, the Blue Shield of Northeastern New York.
No.
No.
Yeah. So
Brandon will talk to you about that.
Sure.
Yeah. So Seth, that platinum EX with Blue Shield of Northeastern New York, they're technically they're called Highmark in 2022, but still Blue Shield. It's still the Blue Shield of Northeastern New York company. The EX plans, those are built for local businesses for their local employees. You must live locally. You must designate a local primary care physician within the Blue Shield network, but you still have access to the national Blue Card, national network of providers outside of the New York area. So just the stipulation is you must live locally. So the EX plans are really great and really popular for folks that live here, but still want access to a national network with in-network benefits.
Right. And that's, so that that answers that. I guess what I'm looking at, and I think it's similar to Brian, how do you plan from year to year when you don't know, are you going to have a 9% increase? Or remember, there was a 1 year there was like no increase at all, or I think there was even like a slight decrease for what the equivalent of the current plan that we had.
Yep.
So, trying to plan for that, as well as trying to keep our budget within reasonable range, to me, and I'm not necessarily suggesting that we do this, I don't know how we keep the increase down and stay with the platinum plan. Now, again, I'm not necessarily saying that we go to a gold plan, although you did say a number of years ago at some point we're going to have to look at gold plans.
Yeah.
So,
yep. And
so
Seth,
I guess I'm trying to figure out.
Yep. Yeah, and that's why you have started to offer some costs. The employees are paying some cost, and Bill can account to that. So you have shared the cost with your employees going forward these past and in the past. So an increase of whatever the percentage is will be spread out between the village and with your employees. And that's why we always talk about a flat dollar amount where you kind of say, okay, every employee is going to cost us this much for an individual, this much for a two-person, and right down the line, a family. And that's the only way you could really budget. If you want a flat dollar amount, everyone, then that's your budget. Any increases get passed on to the employees. That would be probably the only way you could probably keep your numbers where you want to keep them, or know exactly what your cost will be.
Okay.
And
Does
if
that
you
make
did,
sense?
if you did go that route and offered a flat dollar amount, I mean, you could offer a silver plan. I mean, somebody might not want a platinum plan. They might be fine on a silver plan. It's just, I mean, right now, the way it's worked in the past with the cost, the employees pay a portion, the village pays a portion. And you're up against probably some union negotiations as well. I don't know how that works
Oh, yeah.
on your end, but
That we are.
so, but I mean, to answer your question about increases, I mean, yeah, we don't know these new plans for next year until this time of year. So we don't know what 2023 is going to look like, but the only way to know what for your budget would be to, like Judy said, I mean, have a commit to a flat dollar amount that the village is prepared to provide.
Yeah,
Okay.
and also remember, this is Affordable Care Act. These are all federal programs that a platinum plan has to cover X amount of benefits, and then the gold X amount of benefits, a bronze and a silver, it's the same thing. So these benefits in every metal category have to meet the standards for the Affordable Care Act. So the carriers are really, how do they move benefits around? What do they change? Do they add a deductible somewhere? Do they add a little higher copayment on a drug cost? Do they add, how do they keep within the metal pricing that they have to meet the Affordable Care Act? So the carriers have to, somebody's happy.
It's okay.
So does that make sense? Every plan has a percentage of coverage they have to cover.
John, stop.
Carries,
Terry,
I
can
think.
you mute yourself, Terry? Sorry, thank you.
I was muted. Now am I muted?
Nope.
Now we can hear you.
I thought I was.
Looks like
We can.
Tim has a
There
There we
question.
go.
Good.
Go ahead, Tim.
Okay.
Yeah, just quickly, I wanted to know, in reference to the gold plans, do they also have the they can be carried nationally as well? And in particular, the CDPHA, I guess I should be more
So
specific.
this particular option 2, I think you're referring to CDPHE Gold 224.
Yes,
That's
exactly.
a local plan. So no, that's a local HMO. It only utilizes the local CDPHP network. I know you see that -18.
I was so afraid you were going to say.
I wish that
Yeah.
were not the case,
All right.
but it's a very popular plan. A lot of local businesses are on those HMOs.
Well, it's
Yes.
reasonably costed, but although I can see that the out of pockets are substantially, and deductibles are higher,
yeah, it's,
which is would state why, but
Yeah.
it was.
there are
I
some,
I had a strong feeling you were going to respond that way. Okay,
I
thank
know.
you.
But it is, there's no deductible on that particular plan. If you look next to primary care, PCP means primary care. If folks elect a local primary care physician that CDPHP calls an enhanced primary care, those visits are $0. Generic drug, tier 1 generic drugs are $0. So that plan is very popular from a cost standpoint, but the major drawback would be it's just not a national plan. So
Yeah, the out of pocket is higher, and the
out of pocket's a lot. Yep.
and the
Yeah,
out and the outpatient surgery and inpatient hospital.
Yeah, inpatient hospitals 1,500.
Yeah.
So I mean, there are some big items there. There's no, there's not percentages. So, try to stay away from.
It's great if you don't have to go in.
Correct. Yeah.
Stay out of the
Right.
hospital.
If you don't want to use it.
Bill,
Just
are
a
we
little
now to where, do we have all employees paying 20% now?
Yes.
Okay, because we built that up over years to give them a gradual
Yeah.
increase, and even the unions now are at the
All the
20%.
cops are 20%, the DPW and all the non-union people are at 20%.
Took us a while to get there, but we are now.
We're there now. Just a little history here. We do have 2 retirees that are, one is in Florida, one is in Georgia. They are on the Medicare Advantage plan. but that's a different plan because PDPHP, Medicare Advantage, don't go down there, but it's the best plan we can get. Similar to that, we usually get Blue Cross, right, Judy?
I'm sorry, Bill, what about Blue Cross?
For Jerry and Peter.
Yeah,
it's
we use
usually
we use United Healthcare. We went to the
United
national
Healthcare, I'm
market.
sorry, right.
Yeah, Medicare Advantage plans are a little different. They are zip code specific, and they have to be purchased in the state you reside and the zip code you reside. So we go to the local markets and purchase the plans directly for those members, and then they are reimbursed by the village. So they send their bills up
Right.
to the office, and Bill gets them reimbursed. And it's kind of been, it's not been an easy process for Bill either. He's got to, make sure the bills get paid, and it's not easy dealing with United Healthcare sometimes. It's a little more difficult sometimes for him, but we made it work, right, Bill?
Right, we did. And then we also have one retiree who's not Medicare eligible that lives in North or South Carolina. So he's covered under the current platinum plan, him and his spouse. Because he's got the national network with it. And I'm trying to think, he's the only one that I think of that's out of the area.
Yep.
So
we can offer multiple plans. I don't know if that's something you would want. I mean, like I said, the platinum plan, it's great. It's just expensive. I mean, if folks wanted a gold plan, and I mean, you would have to work on your contributions, or if it's less, they're going to want to pay less. Where does the savings come in? Bill would have to work his magic with his numbers.
Thanks. I also, Seth, in response to your question or answer, when I do the budget for next year, when I start, I know what June to December is going to cost us because that's what we're paying now. And then I just take whatever rates there are and I add anywhere between 10, 15, and 20% to it based on what I hear out there that the insurance is doing. You can check a couple of months ahead of time and it'll tell you, hey, they're looking at a 8% increase or a 20% increase. So I try to add that in so the budget covers any big increases, hopefully for 5 months.
So Bill, as an example, do you remember what your budget bump was for this current fiscal year?
If I'm not mistaken.
Yeah, well, Bill's getting that. What we do is we take the quarterly rates and give the information to Bill, because the rates are distributed each quarter. It's called rolling quarterly rates. So every 3 months, the rates come out, they change or whatever. When you buy during the year, there's not just one rate the whole year. They change throughout the year. So
Okay.
Bill is given all that information. Then he, like Brandon says, does his magic and puts a number in there so that the village can, have the money there when you come to pay your bills this year.
So you're saying that the rate, for instance, to start January 1st is what we see on the page. But if you bought, let's say, March of 2022, that rate may be a percent, whatever percentage increased.
Yeah, well, March is still first quarter, but if you bought a different quarter of the year, it's based on the quarter you buy, the quarter you start.
Yep.
So these are all first quarter rates, but second quarter, third quarter,
Right.
it changes each quarter, but whatever you buy, you lock in for 12 months.
Okay.
If I'm not mistaken, I added 20%.
Okay. So
To the
for
rate.
instance,
To the
so
rate.
for instance, right. So if this, all right, I got it. So 20%. So if this is only 10, then technically there's still
A little
10%
money left.
left over. Okay, got it.
Right.
that-
And it's, like the year we had the zero increase. That was nice because I had figured
Right.
out
Right.
a bump prior to that. But, it's not
But also, Seth, I mean, that's why we do this every year. We look at everything that's out there. You
Yeah.
know, if one carrier goes up 15, 20%, then, you know, we look. Is there something
Yeah.
comparable that will meet your needs and not be so expensive? I mean, we do this with all of our clients. We are, you know, every year upon renewal, just see what's on the market, what's new, what the prices are, and there's something better, you know, if it works, we make a switch.
Okay, yeah, and I know we had talked before, you know, if it made sense to stay with the current provider or the current plan, just so you wouldn't have to keep issuing new cards. And for a number of reasons, I'm interested in staying with CDPHP, and I think based on the data, it probably makes sense. But you know, I'd be interested in hearing from people. You know, do we stay with you know, option one, or do we consider the gold? I don't know. I'm conflicted. I know that Judy always tells us focus on the out-of-pocket max, and that's always the thing my eyes go to first. So, and that part tells me I don't want to go to the gold plan, but I'm just, you know, I know it's there as an option for comparison's sake, at least.
Yeah.
After the year, if we were taking a poll, I would like to stay with the current plan. So there's that.
Yeah, I haven't heard any complaints from anybody. Don, have you?
Talking to everybody likes the current plan. They weren't exactly. We had a lot of problems when we had the Empire plan, especially like when Renee was down in Florida and she got hurt. It took, you know, Brandon will tell you, we had, remember all the problems we had getting her bill paid.
Yes, sir. I do. I do remember that.
And we got it paid though.
We got it. It took,
Yeah,
you know,
They were
bad.
bad. Yeah, that was a battle. And we let
the
them.
police, you know, the police are very happy with the current plan. And they're usually the ones that are most boisterous about the insurance plans.
Yeah, and we haven't had a lot of service issues. If we do get them, usually Bill or Don will know about issues that we have so that they understand what's going on our side too. But CDPHP, for the most part, is a very user-friendly plan. The doctors in the area, all the hospitals, I mean, it's run by doctors, and the doctors, it's a good plan. It's a very nice plan, but we're very fortunate. We have lots of good plans in this area, and we have a very rich network with all of our plans right here. We're very fortunate.
I would also be in favor of staying with CDPHP again for option one. The gold just has, the other numbers are just way too high. Urgent care is higher, the ER is higher, inpatient is higher.
Yep.
Agreed.
But do you think
the out of pocket?
Yeah, but you don't think folks would they wouldn't want like a lower cost per month? I'm just throwing it out there.
We've done that before. No one took the plans. We've offered
Yeah.
dual plans. We've tried it. You can still
One
continue.
year, nobody took
Okay.
the low plan.
Nope.
With COVID still prevalent, I just think sticking with exactly where we are is the best thing for the employees, and you know what I mean, and
Yeah.
Is there a minimum number you would have to have if you were to offer a second plan? Do you have to have a certain number of employees to sign on to it?
Not
Make
within
it
CDPHP. You know, if it's a second CDPHP plan, you could have it available and nobody elect it. You know, if you went with a different carrier, we would have to have enrollment to keep the group open. But
Yeah, I think we did that probably multiple years in a row and nobody took it. So then I think the one year we didn't even bother offering it because they were all going with the better plan to begin with.
Do you think it's worthwhile to at least put it in consideration for people again?
People like options. I throw it out to them. And,
I mean, sometimes I don't think they take the time to, you know, and they're probably looking at the exact same things we look at. Oh, should I go in the hospital? This is going to be my cost here, as opposed to what it would have been. So,
I mean, to be honest with you, I might take the gold plan from CDPHP.
Well, every employee gets a letter from Don explaining what plans are available, how much they will pay bi-weekly. Because I figure that all out before we even get to January. And we send it out early, so if they want to switch, we get the stuff done and out to Judy in time. And I think the last time we offered two plans was in 2019. We offered Empire Blue Cross Platinum and the Empire Blue Cross Gold.
Yep.
And the difference, roughly bi-weekly for a family coverage was $20, and nobody took the gold plan. So they were saving $40 a month just on out of their paycheck, and nobody took it. So, you know,
Okay.
I figure it out, and I figure it out for each plan. You know, and I'll say, okay, here's the letter, the biweekly contribution through payroll deduction for January 1 will be as follows. And I put down the current plan, what you're paying, and then for the next year, whatever plan is offered, these are the costs for you. So you can look at that with your pay and say, okay, I'm going to save $40 here or whatever it is a month. What am I going to spend, you know, at the doctor, at the pharmacy, whatever? Is it going to make a difference? I try to, keep them all informed, because you guys, when we get done, when you guys decide what plans you want, you're going to have next meeting, you're going to do a resolution that says, these are the plans we're offering. So if you offer more than one, then I record more than one.
Which maybe it's not a bad idea. Give them the option again. We've done it before.
I'm
Why
good.
don't we do it again?
I agree. Yep, I'll agree with that.
So
There's-
stay within
I mean-
CDPH, please.
Yeah, this gold plan on the chart it's the local gold. There's national gold too. I just put this one on because it had no deductible.
Okay. The only thing is we'll have to let the South Carolina or North Carolina guy know that he isn't allowed to take the gold plan because it's not national.
Correct.
Oh, yeah, that's a good idea.
You know,
Who wants?
he's the only ones, but oh no.
Just
Peter's wife and daughter.
Peter, his family,
They'll
on the
have
plan,
to
parent, child.
Yeah,
Georgia.
they can't take the gold plan either.
And you never know who's going to retire and move down south.
I don't know.
That move is a
Retire and
qualifying
go
event.
south?
You can move them. But and then so just the other, like with local plans, if anybody has children in college that are out of state, those local plans don't always work. Some folks will stay on the local plan. They'll keep their local, primary care, and they'll come home for doctor's visits, but they still have emergency coverage. Even on a local plan, you're covered for emergencies nationwide. It's just, elective care you can't do outside the area.
So Bill, when you send your letter, just be specific with that. So
I
anybody knows, like Frank's retiring next year as well. So,
He's
just
going to Tennessee and.
But if they retire and move, that move would be a qualifying event. So if they were on a local plan, we could switch them to a national plan.
Yeah.
Yeah, but just make sure everybody's well
I think
aware.
one is retiring in March. I think Frank is retiring in March, so he'll switch from. Well, he may switch, he may not. I don't know.
How would you configure the contributions if the gold plan is
20%.
Still 20?
Still 20%.
Okay, so the village will just pay more towards your platinum plan than a gold plan.
Yep.
Okay.
Yeah.
All right, do we have a consensus here? They're offer the two, option one and
Option
two.
1 and 2. And we'll keep
Yeah.
the dental and vision because they didn't
Yeah.
change.
And I think that that we ought to just look at next year. who takes the options 1 and 2, not
Yeah.
not individuals, but just, this number
How
versus
many?
that number, so that we can, we can see, okay, is that worthwhile offering, and does it help individuals by, again, like Brian said, he might take the gold plan if offered that way. So
Yeah, Bill,
see
once you get the feedback and you're ready to go with it, just send us all a quick email so we're aware
Oh, I
of
will. I'll
what
get
happens.
it all out together probably next week. I'll probably get something.
And if any folks want to just look up, anything, doctors or, prescription costs, as always, that's what we're here for. If they're trying to decide between the two, or better, if they need more of an individual explanation, we're always available to chat.
Appreciate it.
Appreciate that, Brandon.
Thank you.
Yes, sir. Thank you, Meg.
All right,
right,
so
so-
I will put together the resolution for the next board meeting. And I will get a new chart out that I sent you to show the costs, and I'll put the 2 plans down and how much it's gonna cost everybody each pay period.
Good.
Okay.
Okay?
All right.
So
you.
so is the plan then to approve that at the mid-November meeting then?
Yes, yes.
Okay.
Yep.
Okay.
And then the letter, to the employees will go out the next day.
Good. And all of
I'll have
that
them.
should also give plenty of time to Judy and Brandon to
Right.
get out what they need to.
Yep.
Right?
Oh yeah,
Oh, yeah.
totally,
Oh, yeah.
definitely.
And I come in every fall. I come in, I'm there for the most of the day and answering questions and, taking applications,
Yeah,
talking with
if somebody
employees,
wants to
answering
change or
questions.
something.
Yep.
She'll probably be here last week in November, beginning of December.
Whatever you want.
And, for an afternoon, she'll sit here and everybody will.
Yep.
If you want to talk to her, she'll be here in this office or over in the police department.
And without, since they're not changing carriers, we don't need new applications or anything.
Right.
We just need confirmation which plan they want.
Uh-huh.
That's good. So that makes it easier. And you say, hey, here are your options. You don't really have to do anything. And depending on what your medical trends are, you can make that decision.
Right.
Yeah.
Yep.
ID card, everything stays the same.
Judy,
Good.
do we have ID cards for Guardian? For the vision?
You should. They don't automatically send those out. Are you looking for some? Do you need them?
Yeah, I have the Delta Vision or Delta Dental, but I don't have a Guardian card that
Guardian?
Actually, we
Alright.
have those, there's a generic card.
Yeah,
There's not individual cards. We have those
There
in the
should-
office, Meg. I'll put one on
there's-
your desk.
Yeah, there should be some in the office. They come in a sheet. They're real fancy. They're perforated on a sheet, and you take your card off and you use that.
All right.
Yeah,
I didn't
well-
realize they were there. All right,
Yeah, I
good.
didn't either. So,
All right. Anybody have any other questions? No?
Motion to adjourn?
Yeah, it's so 6:09, we will close the public or the workshop. Somebody just second that. We'll make it official since Brian.
Seth?
All in favor?
Aye.
Opposed? All right,
Thank you,
Carrie,
everyone.
we'll send you the recording, and then Judy and Brandon, thank you very much.
Thank you, everybody.
Thanks, Judy.
Thank
Thanks,
you, Matt.
Brandon.
Thank
Thanks,
you.
everybody.
Take care.
Appreciate
have a
it.
good one.
Talk to you.
Thank
Have
you.
a good one, guys.
Bye.
Bye.